Okay, my number one tip for successful breastfeeding is to know who your support person is before you give birth. So that might be an IBCLC, and knowing who you're calling before something goes off plan will always save you a lot of time and stress on the other side.
As far as breastfeeding goes, there's really no need to prepare your breasts for breastfeeding. They know what to do. You don't need to pre pump or rough up your nipples. Ouch, by the way, or attempt to fix flat or inverted nipples. If anyone can get your nipple to come out, it's your baby. There are rare, unique situations such as inducing lactation when you're not the birth mother, which really call for one on one lactation support pretty far in advance to baby's arrival. But for most of us, our breastfeeding action plan starts when your baby is born and put skin to nurse. Let your support person and the hospital staff know that you intend to breastfeed and bring a crib card as a visual reminder if this is a point of anxiety for you.
Other common questions as far as breastfeeding preparation that I get include what kind of supplies do I need? Do I need pillows? Do I need this? Do I need that? And they're all so unique to each mom. One common question I get is, do I need breast pads?
Not every mother leaks breast milk. If you're leaking colostrum during pregnancy, you have a higher likelihood of needing breast pads, although there's no surefire way to know ahead of time. I think it's nice to have some on hand just in case you do. There are four common types of breast pads: disposable, washable, silicone pressure based pads, and good old fashioned homemade ones. Disposable ones are great in the beginning when supply comes in to avoid waking in a puddle if you start off extra leaky. And this applies to all moms, whether they intend to encourage a milk supply or not. Washable pads are great if you are environmentally conscious or once your supply has settled a bit around 6 weeks. Silicone pressure based pads work by putting enough pressure on the nipple to block milk flow. I don't recommend these for mothers with a history of mastitis, plug ducts, or other breast and nipple issues. In a pinch, though, you can even apply light pressure with your hand to your nipple to stop from having a major leak situation. And of course, you can make your own. You can use a super soft washcloth or a clean burp pad or really whatever is absorbable and within reach when you're letting down. Most moms like to narrow down their most important feature based on their preferences. So, eco friendly, ease of use, least noticeable under their shirt, minimal chemicals, most cost effective, etc. And then test a few different types to find what they like best and what fits best for their breast. I also recommend a nursing bra or a tank that's softer and more flexible, ideally a breathable fabric such as cotton. You'll need a larger size than you wear at the end of your pregnancy to accommodate fuller breasts and engorgement. This is true whether you intend to breastfeed or provide breast milk or not. And knowing the exact size is tricky, but having a flexible, larger size on hand is ideal. I don't recommend very tight or restrictive clothing on your breasts after birth. It can cause some breast issues. Nursing bras and tanks allow you to place a nursing pad or in a pinch to stuff a burp cloth in them in order to keep your shirt dry. Another thing I like is that they're easy to unclip with one hand so you can provide breast access to baby while you're holding your baby. Something to watch out for, though, is that although these can make things much easier, we don't want to be wearing a fabric barrier constantly that interrupt that skin to skin time with your baby. So here's what I mean. If your baby's laying on your chest, but you have a tank top on and then baby has a onesie on, that's not skin to skin. It's really great snuggling, but it's not skin to skin. Clothing that fully opens at the front or even simply pulling your t-shirt all the way up and then having your baby only in a diaper, that gives you access to truly have your skin to baby's skin. Let's talk about what the best nursing pillow is. It's such a common question, and you may have a lot of friends with babies or older kids who swear by the brand and type that they used. And although everyone seems to have an opinion about this, finding which breastfeeding pillow, and even if you need one, depends on a lot of factors that are really specific to you and your baby. So, some important factors that go into finding the right fit would be your body shape. Do you have a long torso or a short torso? How long are your arms? Do you have large breasts or small breasts? Another factor is your baby's size and length and where you're feeding your baby. Are you on the couch? Are you in your bed? Or do you have a dedicated breastfeeding chair or nursing chair? And of course, what position you're feeding your baby in: lying down, sitting up, cradle, football, etc., etc. Let's talk about some tips in figuring out what support you may or may not need. Step one is get good alignment. You want to have your baby in really good alignment and get a really good latch. Most of their weight should be on your body if possible. So, not on your left arm or all of the weight being down on a pillow, for example. Their body weight should be mostly resting on your body. Then you want to get comfortable. You can use a pillow or a prop wherever you need it to fill in the space to make sure that you can relax and be comfortable in a position that your baby's in good alignment and is also comfortable. This is a lot easier to do if you have another person, for example, a lactation consultant, to help you kind of fill in the pockets of where you need support and brainstorm where to shove a little pillow or prop. Um, and also to kind of remind you from the outside in that, hey, relax, lean back, try to get comfortable. It's not a good fit if your baby is kind of sinking into the center of the pillow. It's not a good fit if your baby's hips and shoulders are rolling out away from you. If the baby is positioned too high to get a good alignment in order to get a good latch, that's also not a good fit. And of course, if you're uncomfortable, we really want good alignment and comfort for the baby, but also for mom. You do not need to start having neck and back problems because you're have the perfect latch and your baby's happy, but you're really uncomfortable in holding that position for too long. That's not a good fit. All right, so these are great tips for after baby's arrival, but you may be asking, what am I supposed to do now, before baby comes? For now, consider where you think your dedicated spot or your primary feeding spot will be and see if there's any major gaps in comfort. Is there a really large space between your elbow and the arm of the chair? Is there a really big gap in your back that's a little bit uncomfortable? These might be some helpful considerations when thinking, oh, I might need a little support here or there.
Another really common question I get is, do I need nipple cream? And you really only need nipple cream if your nipples are dry.
Dry nipples tend to be more common in women with more melanin in their nipples, meaning they have darker nipples. But like with everything, that really just isn't always the case. If you find yourself with dry or flaky nipples, you can consider an edible safe moisturizer. Keep in mind, any nipple residue may be ingested by your baby. So here are some examples: coconut oil, olive oil, badger balm. You could put a little bit of breast milk on your nipples and then let them air dry, etc.
Okay, I said it before, but I'm gonna say it again because it's that important. My number one tip for successful breastfeeding is to know who your support person is before you give birth. This could be an IBCLC, or a CLC, preferably with great experience and good references. Many hospital lactation consultants would love to support you after your baby goes home with you, but they don't have the time or resources to do that. It's just not realistic. So, knowing who you're going to call after you get home, if there's a bump in the road, can be really a lifesaver, especially when you're sleep deprived and a little bit extra stressed.